So the tear film being the first refractive surface that we encounter from the air, it's so valuable for us to have a super smooth tear film and corneal surface. If that is affected, we can detect that with hyperosmolarity in our office. And if it is being affecting the patient, it's going to disrupt the visual clarity that they have. In some studies, it could be as bad as even having a grade 1 or a grade 2 cataract. And that clarity of vision is something that patients from a refractive standpoint are really looking for. If they're going to spend, hundreds of dollars on a pair of glasses, or they're desiring to have comfortable and clear vision with a contact lens, if the osmolarity is disrupted, it means the tear film and the corneal is disrupted, and we're going to have a breakdown of the visual system.
Hyperosmolarity on the corneal surface damages the front surface. And so when you have a hyperosmolar state, you wind up with light scatter. And that light scatter means that patient's not going to have the best vision possible. So that really matters no matter what part of the practice we're talking about, whether it's a spectacle prescription, whether it's a contact lens prescription, prepping a patient for moving on to cataract surgery. All of those places, we need our patients to see their very best. And if there's a hyperosmolar state on the front surface, we're losing light due to scatter.
Hyperosmolarity and osmolarity testing go from the dry, esoteric world to more of the mainstream clinic these days, right? And why is that? Well, it's in pursuit of the happy patient, good outcomes. We used to think of that as 20/20, but we know we have that smaller subset sometimes that is 20/20, but they're unhappy, 20 unhappy, right? Why is that? We know the literature now points to things like light scatter. So when you have a cornea that looks normal, there may be no staining, tear breakup time looks good, just something going on there, right? We have good IOLs these days. We don't have to worry about centration. When there's things going on with hyperosmolarity, we can catch that and identify things like light scatter that really help to pinpoint why some of these patients are unhappy, even though they're 20/20.